Have you ever started your day with a painful, throbbing ache in your knees, back, or shoulders, seemingly for no reason? This is what I hear from many of my senior patients in the clinic. Doctor, why doesn't this patch feel cool at all? I get this question all the time. Hello, I'm Dr. Lucas Miller, an orthopedic specialist. If you watch this video to the end, you'll see how a single pain patch, when applied correctly, can completely heal your knee, back, and shoulder pain. Mary Johnson, 72, from San Diego, used to visit the clinic every other day for back pain treatment. Recently, her knees also started bothering her. So she followed my advice, and now both her back and knees are completely healed, and she says she feels no pain at all. She even told me she sleeps much better at night. Another patient, John Smith, 75, from Miami, said that since he started putting a patch on the front of his knee and on the other spot I showed him, his knees feel much lighter when he climbs stairs, and he can easily go up 3 or 4 flights. If you watch this video to the end, you'll wake up with a comfortable back, your knees won't hurt when you climb stairs, and your shoulders will feel light when you lift your arms. Before we begin, please hit the subscribe and like buttons. If you turn on notifications, you'll get useful health information quickly. Let's start. First, let's talk about back pain. Back pain can truly make the whole day difficult. It's hard to straighten your body when you wake up in the morning, and it hurts when you stand up after sitting for a long time. Even going to the bathroom or cooking in the kitchen can become difficult. I have a patient named Michael Brown, 68, from Los Angeles. His back pain kept him from sleeping at night. He had been putting patches on either side of his back, but they didn't seem to help much. He told me his back was so stiff every morning that it was hard to even wash his face. So I told Michael, try putting the patch on the center of your lower back and on the arch of your foot. A few days later, Michael called me. He said, "Doctor, my back pain is much better, and I'm sleeping well." He was so grateful and said he was surprised by how comfortable his back felt when he woke up. For back pain, try this. First, put a patch on the center of your back, right where your spine is. Most people only put patches on the sides, but putting one in the center is much more effective. To find the center of your lower back, just bend forward a little. You'll feel some bumps on your spine. That's the lumbar area. Put a long patch vertically on the most painful spot. And there's one more important tip. Put a patch on the central arch of your foot. It might sound strange, but your foot and back are connected. Our bodies are all connected, so if your foot hurts, your back can hurt, and vice versa. That's why there's a traditional method of treating back pain by pressing on the foot. To find the central arch of your foot, look for the part that's indented between your toes and your heel. You'll feel a soft, tender part there. That's the arch. Putting a small patch there can help relieve back pain. When applying the patch, make sure to clean your skin and avoid any open wounds. Don't leave it on for too long. Take it off after 4 to 6 hours. If you put it on before bed, your back will feel much better in the morning. For foot patches, it's best to wear them when you're at home, as they might fall off with socks. You can put them on while you're sitting on the sofa watching TV or reading a book. On days when your back pain is severe, try treating both your back and your feet at the same time. You'll definitely feel a difference. After applying the patch, gently stretch your back by twisting it slowly from side to side. This will make the patch even more effective. Now, let's move on to the second topic: knee pain. Knee pain can really make daily life difficult. Your knees throb every time you go up or down stairs, and they feel wobbly when you stand up from a chair. It becomes hard to go grocery shopping or to play with your grandchildren. I have a patient named Emily Davis, 75, from Chicago. The front of her knee was so sore that it was difficult to walk. She said her knee felt so stiff when she took her first step in the morning that she almost limped. When she climbed stairs, she had to hold onto the railing and go up one step at a time. Emily had always been putting patches on the back of her knee, thinking that's where the pain was. But it wasn't helping much. So I told her, try putting a patch on the front of your knee, around the kneecap, and near your heel. A week later, Emily called me. She said, "Doctor, my knees feel so much lighter when I go up and down stairs." Her voice was so happy. She also said her knees felt much smoother when she woke up in the morning. If you have knee pain, try this. Put a patch on the front of your knee, around the kneecap, patella. To find the kneecap, feel the round bone on your knee. That's it. Put patches above, below, and on both sides of this bone, as if you're wrapping your knee. If the patch is too big, cut it in half and use several smaller ones. Since the knee is a constantly moving joint, a patch that's too big can feel uncomfortable. Using several smaller patches is more effective. And here's another surprising secret. Put a patch near your heel. This might sound strange, but your heel and knee are also connected. The heel is the first part of your foot to hit the ground when you walk. If it's sore or stiff, it can affect your knee. If your heel doesn't absorb shock properly, that shock travels up to your knee. Here's how to apply a patch to your heel. Put a small patch on the indented area at the bottom of your heel, near the border where it meets the arch of your foot. There's an old saying that massaging the heel can relieve knee pain. It's a method filled with the wisdom our grandparents used to share when they massaged our feet to soothe our aching legs. When applying a patch to your knee, remember that it's a very mobile joint, so you shouldn't leave the patch on for too long. Take it off after 3 to 4 hours and let your skin rest. Also, cut the patch to a size that won't pull when you fully bend or straighten your knee. If the patch makes your knee movement uncomfortable, it could cause pain in other areas. After applying the patch, try some gentle exercises like slowly bending and straightening your knee. Sitting on a chair and extending your leg straight out is also good, as is gently rotating your knee. Just changing the patch location can make a big difference. If you're suffering from knee pain, be sure to give this a try. Now for the third topic, shoulder pain. Shoulder pain can be so frustrating. It's hard to lift your arm up or even twist it behind your back. It's tough to put on a shirt sleeve, or even to comb your hair or wash your face because your shoulder is so stiff. It can even keep you up at night because it hurts to turn over in bed. I have a patient named Elizabeth Green, 70, from Seattle. Her shoulder pain made it hard for her to lift her arms to hang laundry. She also had trouble reaching for things on the top shelf of the fridge and couldn't even hug her grandson because of the pain. Elizabeth had always been putting patches on the back of her shoulder, thinking that's where the pain came from. She'd put them on the back of her neck and shoulder every day, but they didn't seem to help much. So I told her, try putting the patch on the top of your shoulder joint, around the scapula, and on the bottom of your big toe. 2 weeks later, Elizabeth called me. She was so happy and said, "Doctor, my shoulder feels so much lighter when I lift my arm, and I can finally hug my grandson easily." If you have shoulder pain, try this. First, put a patch on the shoulder joint, which is the round part where your arm and body meet. To find the shoulder joint, feel your opposite shoulder with one hand. You'll feel a round bump. That's the shoulder joint. Put a long patch vertically on the top of this area. Also, put patches around your scapula. The scapula is the wing-shaped bone on your back. It moves with your shoulder, and if the muscles around it are tight, your shoulder will hurt. To find your scapula, reach behind you with one hand and feel the center of your back. You'll feel a flat, triangular bone. That's the scapula. Apply patches along the edges of this bone. It's important to apply the patch along the direction of the muscle fibers. Shoulder muscles run from top to bottom, so putting the patch on vertically is more effective. And here's one more amazing secret. Put a patch on the bottom of your big toe. This might sound strange, but your big toe and shoulder are connected. Your feet have reflex points connected to your whole body. The area under your big toe, in particular, is a reflex point for your shoulder. Stimulating this area can help relieve shoulder pain. Here's how to put a patch on your big toe. Put a small, round patch on the plump area right under your big toe, the thickest part of your foot. It's best to put a patch on both feet. If your right shoulder hurts, put one on your right foot. If your left shoulder hurts, put one on your left foot. But putting them on both feet is even more effective. There's an old saying that getting a foot massage can make your whole body feel better, and that pressing on the big toe can make your shoulders feel better. This method is based on that principle. When applying patches to your shoulder, remember that it's a very mobile area, so the patch might fall off easily. It's best to apply it when you're at home and not moving around much. And don't use a patch that's too big, as it can feel uncomfortable when you move your arm. It's better to cut it into several smaller pieces. After applying the patch, gently rotate your shoulder. Do 5 rotations forward and 5 backward. Also, try gently lifting and lowering your arm. Don't overdo it. Just move as much as you can without pain. With just one patch, you can take care of your shoulder and foot health at the same time. If you're suffering from shoulder pain, be sure to give this a try. What was the most effective spot for you? Share your experiences in the comments to help others. Next, I'll tell you about some practical tips to double or triple the effect of your patches. Here are some practical tips to double and triple the effect of your pain patches. I have a patient named Robert Jones, 66, from Denver. He used patches frequently but found the effect didn't last long. He would put a patch on in the morning, and the pain would start again by noon, so he'd have to put another one on in the evening. This repeated every day. The patches were also expensive, and his skin was getting sore. So I taught Robert several ways to increase the patch's effectiveness. I explained everything from skin care before applying the patch to the correct duration and simple stretches. Now he says a single patch can last him all day. The first tip is skin care before applying the patch. Many people just put the patch on, but that's a waste. Before you apply it, use a warm, damp towel to steam the area for about 5 minutes. This improves blood circulation, so the patch's ingredients are absorbed better. Here's how to do the warm towel steam. Soak a towel in warm water and wring it out. It should feel warm to the touch, not too hot. Put this towel on the painful area and wait for about 5 minutes. Then, clean your skin and apply the patch. The second tip is to follow the correct application time. Many people leave the patch on all day, but that's not good. Take it off after 4 to 6 hours. Leaving it on for too long can make your skin red or itchy. After you take it off, let your skin rest for about 2 hours. Then you can put a new one on. This way, you can keep getting the benefits of the patch without skin problems. The third tip is to do some simple stretches with the patch on. Don't just stay still after you apply it. Slowly move the area. If you put a patch on your back, gently twist it from side to side. If you put one on your knee, try bending and straightening it. But don't overdo it. Just move as much as you can without pain. This helps the patch's ingredients spread more evenly, making it much more effective. The fourth tip is to adjust the patch size. Don't just use a large patch as it is. Cut it to fit the painful area. Often, several small patches are more effective than one big one. This is especially true for joints, which move a lot. The fifth tip is to massage the area before applying the patch. Use your hand to gently massage the area for about 5 minutes before you apply the patch. Don't press too hard. Just gently rub in circles. This will relax the muscles and make the patch more effective. Now, I'll answer some frequently asked questions. Doctor, can I change the patch location? Yes, of course. You can put one on your back today and on your knee tomorrow, or you can change the exact spot on the same area. This is actually better for your skin health. How many times a day should I apply a patch? 2 to 3 times a day is good. You can put one on in the morning, once in the afternoon, and once in the evening, but always remember to only keep each one on for 4 to 6 hours. And be sure to give your skin a break in between applications. Can I take a bath with the patch on? Please avoid it. The patch might fall off when it gets wet, and its effectiveness will decrease. It's better to take the patch off before your bath and put a new one on afterward. What should I do if the patch makes my skin itchy? Take it off immediately and wash the area with cold water. Then, stop using patches for about 2 days. If you have sensitive skin, it's a good idea to test a small piece of the patch on a less sensitive area first. Can I use it with other medications? If you're taking any other medication, please consult your doctor or pharmacist first. There are usually no issues, but it's safer to check if you're taking blood pressure or diabetes medication. Finally, here's one more crucial tip. Don't rely only on patches. Try to keep your body warm in general. Drink warm tea often and avoid cold foods. Especially in winter, use a scarf or a lap blanket to keep your joints warm. If you have any experiences or effective methods with patches, Please share them in the comments to help others. Try the methods I've shared today. With just one patch, you can live a comfortable life. You've watched this video well. From now on, you can be active with a strong, steel-like back, knees, and shoulders, doing whatever you want. I have shared step-by-step how to effectively manage back, knee, and shoulder pain with just one patch. We've covered a lot, so let me summarize everything we've learned today. First, let's review back pain management. When your back hurts, you should put a patch on 2 spots. The first is the center of your lower back, the lumbar area. Bend forward a little, and you'll feel some bumps on your spine. Put a long patch vertically on the most painful part of that area. Most seniors only put them on the sides, but putting one in the center is much more effective. The second spot is the central arch of your foot. This is the soft, indented part between your toes and heel. Your foot and back are connected, so putting a small patch here can help relieve back pain. Remember how Michael Brown from Los Angeles was able to sleep soundly with this method. Next is knee pain management. When your knees hurt, you should also put a patch on 2 spots. The first is the front of your knee, around the kneecap. Feel the round bone on your knee, and put patches above, below, and on both sides, as if you're wrapping your knee. If the patch is too big, cut it in half and use several smaller ones, which is more effective. The second spot is near your heel. Put a small patch on the indented area at the bottom of your heel, near the border with your foot. If your heel doesn't absorb shock properly, it can affect your knee. Remember how Emily Davis from Chicago could climb stairs much more easily with this method. Let's also summarize shoulder pain management. When your shoulder hurts, you should put patches on 3 spots. The first is the shoulder joint. Feel the round bump where your arm and body meet, and put a long patch vertically on the top of it. The second is around the scapula, the wing-shaped bone on your back. Feel for the flat, triangular bone behind your back, and put a patch along its edges. Since shoulder muscles run vertically, a vertical patch is more effective. The third is the bottom of your big toe. The plump, thickest part of your foot right under your big toe is a reflex point for your shoulder. Put a small, round patch there. Remember how Elizabeth Green from Seattle was able to hug her grandson with ease thanks to this method. Now, I'll quickly summarize the practical tips to boost the patch effect. The first tip is to do a warm, damp towel steam before applying the patch. The second tip is to follow the correct application time, 4 to 6 hours, followed by a 2-hour break. The third tip is to do stretches with the patch on. The fourth tip is to adjust the patch size. And the fifth tip is to do a gentle massage before applying the patch. I've also answered your frequent questions. You can change the patch location, apply it 2 to 3 times a day, avoid bathing with it on, and take it off immediately if it's itchy. But as an orthopedic specialist, I have a very important message for you. Applying a patch won't make all your pain disappear completely. Patches are a temporary, supportive method for pain relief. If your pain lasts for more than 2 weeks or gets worse, you must see a doctor for an accurate diagnosis. Especially if you suddenly feel extreme pain, or if your legs or arms feel weak or numb, don't wait, see a doctor immediately. These symptoms might not just be simple muscle pain. The method of putting a patch on the foot and toe reflex points is a supplementary method based on traditional acupressure theory. It may not work for everyone, so please use it only as a reference. The information in this video is a helpful reference for health management, not a substitute for medical diagnosis or treatment. The cause of your pain can be various things, like a herniated disc, arthritis, muscle sprains, or ligament damage. Remember the safety precautions for patches as well. Avoid using them if you have allergies, and never put them on an open wound. If you are pregnant or breastfeeding, please consult your doctor first. But don't worry too much. The methods I've shared today have been proven to work for my patients, including Mary Johnson, John Smith, Michael Brown, Elizabeth Green, and Robert Jones. What's important is consistency and using the correct method. Don't give up after just a day or 2. Follow these steps consistently. And don't just rely on patches. Keep your body warm and exercise regularly. If this video helped you manage your pain, please subscribe, like, and turn on notifications. In my next video, I'll be sharing the right diet for joint health and some easy exercises you can do at home. Let's work together to protect your healthy life as you age. I'm Dr. Lucas Miller, your orthopedic specialist. Thank you.